This is a podcast about the power of lived experiences, about how stories can shape more human-centered systems, spaces, and services.
Each episode, we sit down with people who are challenging the status quo, leading with empathy, and helping others through their work and their stories.
We're Farah and Megan, and this is Collected by Unimco. Today, we're so excited to have Sommer Collins with us. And as we start to think about the heavy travel season that's coming up, we started to talk about what happens when you're away from home and someone you love needs care. For many of us, when we think about that, we don't even know where to start. Sometimes you think that maybe the person you're traveling with knows what to do, or you'll just know what to do in that moment. But Sommer has lived that experience more than once, and not just that, she's turned it into a mission. Sommer is the founder and CEO of ExploreWell, which is a platform that is built to be that health savvy friend, that really knowledgeable person in every city. She is a healthcare consultant, a former expat, and above all, she's someone who's really deeply committed to advocate for empowering people whenever they become patients. So we're so glad that she's here with us, and welcome to Collected, Sommer.
Thank you. Thanks, Megan. Thanks, Farah. I'm really happy to talk to you both today.
Yeah, likewise. We're so excited to have you here.
Thank you.
So, Sommer, when we first met, which was a few months ago, and gotta love the internet for being able to really bring like-minded people together to talk about ideas that really matter to us. You talked a lot about the founding of ExploreWell and really what happened in your own personal experience to get you to that point. And you've talked about how you navigated your daughter's first seizure experience when your family was living in Poland, as well as other things that happened when you were traveling with your family in Spain and in Costa Rica. And so maybe you can take us back to some of those moments and share what those experiences actually taught you about what people need when they're traveling away from home and in those types of vulnerable situations.
Yes. So as a background too, that's, I think, just important for me to bring up. I am a career healthcare consultant. And so the way that I thought about some of the issues that we experienced personally, I was able to take both kind of a personal and professional lens at, which I am really grateful for. So some of the experiences that we had, though they were really stressful, I'm grateful that I had some experience thinking about them on a more professional level. I had been working in quality and patient safety, and then more as I grew in my career, more on the operations and business development side for many years before in 2018, we moved to Krakow, Poland as expats. And when we were there, I really started to recognize that our whole person travels with us and that it's really fragmented to be able to find resources to help you care for your whole person. And we have some chronic health needs in our family. And then we had some issues, like you mentioned, where Ivy had her first seizure when we were living in Krakow. And I would just say, I was, as someone that felt like I typically was a more privileged patient in that I knew how to navigate the healthcare system when I was living in Minnesota, I felt very, very vulnerable. And I felt like I lost my voice and my ability to really advocate for myself and my loved ones when we were in unfamiliar places and I didn't understand what resources existed. And for me, that was really, really scary. And it also made me feel like I didn't have the tools that I typically had. And so I wanted to create them. And when I thought about it, I thought, okay, our family is going through this. And then there's millions of other people traveling and living as expats every year. And then in your hometown, there's many thousands or maybe millions of people that don't interact as often with the healthcare system or with health resources as I do, and started to think about how do I kind of move these personal challenges into a more systematic solution. And so I started developing some tools just for our family when we were traveling. So, for example, we had multiple emergency room visits. We had illnesses, we had injuries. My kids got into a little wrestling match on a bed at an Airbnb on New Year's Eve in Madrid, and somebody ended up stitches, blood all over their face. And we're like, where do we go at 8
Right.
p.m. in Madrid on New Year's Eve to does she have just a head? Does she just need stitches? Does she have a head injury? And so what we did was after a few of these circumstances in different countries, and I started to think, geez, are we just really unlucky? But then the data says 30% of people when they're traveling require medical care because they get ill or injured. And
30% of people?
yeah,
Wow.
and
That seems
and it doesn't
well.
mean every time, but it means that in your travel journeys that 30% of people have engaged in some sort of care when
Wow.
they're away from home. And the more that you travel, the more that that percentage goes up. And so one thing that was really hard for us was we didn't know where to go. We didn't know where locals would recommend. And so we wanted to start to understand, okay, so if we're in an unfamiliar place, where should we go that a local would recommend? And so we
Mm.
started to look into that more before we would travel places after a few things came up. But what that looked like for me was a lot of fragmented information in different places, joining local Facebook groups, reaching out to people that had connections there, trying to find like the local magazines or like in Minnesota, we have like a best doctors, best hospitals, US News World Report, like trying to figure out and synthesize all this information. It's so time consuming and overwhelming.
Mhm.
And you also want travel to be joyful and you want your planning process to be fun. And this is the kind of stuff most people don't really think about until it's happened to them. And
Right.
so I wanted to put together information that was synthesized that relied on credible resources and then also relied on the real authentic feedback of locals. Like this is where I take my child if something comes up. This is where I would go in as an adult and started to piece those pieces of information together in what now we call ExploreWell city guides that are guides that help us
Mhm.
when we're traveling look at what locals recommend and also what's researched by us for medical, wellness, fitness, and special dietary needs. And so we put that into a comprehensive, easy to use guide so that we don't have to be looking and spending all this time researching. And, um, 30% of people require medical care because they get ill or injured, but 40% of US travelers are traveling with some sort of dietary preference, and
Mm.
then over 50 are trying to experience some local wellness resource, and even more than that are trying to engage in some sort of fitness activities when they're traveling. And so again, just thinking about it as the whole person, how do we pool all of this information together in a way that's really easy. It's not cumbersome to research and it helps you make your trip more enjoyable and helps you take better care of yourself when you're there. So
Yeah.
for me, I think about that as a form of advocacy for travelers and for those that are in an unfamiliar place.
Yeah, those are super important to have as resources, just as for anybody. But I wanted to ask, when you were traveling abroad and you had these experiences, you said you kind of lost your voice because you weren't in a familiar environment. But other than the fact that it wasn't familiar, what was the biggest barrier you were facing that you felt like you couldn't find that voice?
We took Polish lessons when we were in Poland.
Okay.
And so we worked with our Polish teacher and we created basically we just built it in Google, but it looked like a table and it was me and then all my children and my husband's high level health summaries. So our blood type, our allergies, any
Mm.
chronic illnesses, any other specific patient preferences. We put all of that basically in a table on one column in English. Then we had her help us. We translated that into Polish because in Poland and in a lot of other countries, you don't have the guarantee of language interpreters.
Right.
In the US, that's supposed to be a legal requirement, and yet it still does not always happen. They moved a lot now to having like virtual medical interpreters, but it's not always the case. So in Krakow, when we would go to, especially an emergency room, the triage staff and the typically non-physician staff very rarely spoke English. And
Mm. Okay.
so there was one circumstance where we were really concerned that my daughter had appendicitis. And I just remember tears streaming down my face and I handed them my sheet that described her blood type, that she had some of these concerns and some chronic complaints, and they read it. And for me, the reason that we had that tool in the first place was because there was two situations before that where we didn't think to have something like that, and we showed up and then we couldn't explain what was going on with her. I was trying to use Google Translate, but we know that that's not always accurate for translating medical information.
Mm.
So tried to basically create tools that helped me have a voice as her mom. And we don't think about those things when we go to the ER in our hometown. If we are, for example, if for here, I'm English as a first language, so I
Hmm.
know that I'm going to be able to communicate with providers. But for people that are living here that are not English as a first language, they need to rely on that an interpreter is going to be there, and that's not
Yeah.
always the case, and that feels so vulnerable and scary. So
Yes.
that's one example of a tool.
Okay, so that was the biggest barrier was the language.
I
Yeah.
would say once we knew where to go,
Hmm.
the first kind of like the first challenge for me is how do we go to the most trusted, reputable place where we can receive the highest quality of care?
Right.
And that is where those city guides come into play. And then that also in the city guides, then I would research and eventually then ExploreWell has tools that say, can you expect staff there to speak English? And so if not, then can we create some of these tools for you that help you be able to paint a picture of your clinical care in the language in which you're traveling?
Okay.
Yeah. Yeah, it's so insightful to hear you describe this situation, Summer, because I love how you had that, that idea, this lived experience that actually kind of forced you to change your approach around creating these summaries, putting them together so that it would almost help to offset the imbalance, right? From like a health equity perspective around feeling like, okay, I might not speak the language, but I am doing everything I can do to be prepared for this kind of interaction or experience if it arises. And so I really love that because I think sometimes that when we think about traveling, whether it's for a short period of time or a long period of time, we think about, oh, okay, I should pack like a first aid kit or maybe some medication, right, in case of some sort of minor emergency. But I think what you're really describing is so much more important, and is really like the other side of that, right? Which is wherever you're traveling in the world, if it first like the language barrier and then the piece that you raise, which I think is equally important, is how do I know that I'm going to get the best quality of
Yeah.
care?
Yeah.
Those are really questions that I think we don't really think about preparing for.
And I think that a
And
lot
not
of,
even,
oh, sorry, go ahead.
no, no, go ahead.
I was just gonna say, I think that a lot of people, when they travel, they don't, they might not even think like, I want the best quality of care. It's like, where's the closest and will I be able to get it? And then it it ends up, if they do need it, then they come back home and they might need like to be retreated and because I'm just thinking with a lot of stories that I've heard from people who go to like a tropical place and they end up getting a bad stomach bug and they go to the
Right.
hospital and they just get treated for it there, but then they come back home to Canada and they're still really sick for months and it's because they just weren't treated properly. And if they had been treated properly right away, then maybe it would have resolved quicker or they would have been able to like mitigate all of the other issues.
Yeah, I think, and that's another piece for me that we don't really have data on that I think is probably, I'm based on anecdotal information and just how much literature is out there on, oh, when you come home and you're sick after travel, or there's all
Mm.
this, so I think, I think there's probably a much, much higher percentage of people that are traveling and they get ill when they're somewhere and
Hmm.
they don't want to interact with the local health system because it feels scary and they don't know
Mhm.
how.
Hmm.
And
Right.
so then what does that do to their experience? So
Yeah.
then
Yeah.
they're not engaging in all of the wonderful local gems of resources, right?
Mhm.
They're the wellness experiences or the fitness experiences or the local cuisine or doing their tourist activities or going to their work conference. They're maybe miserable laid up in their hotel or their Airbnb and they're just waiting till they get home, right, to get their care. And
Yeah.
so that's a negative travel experience. And I know traveling it can be such a gift. We don't want people to have those experiences and
Yeah.
then they're afraid to go somewhere again. So I think about it as sort of how do we help you stay well when you're away from home? How do we help you respond if something happens that's unfortunate and unplanned for? And then how do we help get you back home feeling good?
Mhm.
And I don't think that that's that common to have that spectrum end-to-end experience.
Yeah.
And so really that's my goal with ExploreWell is how do we help people no matter where they are be able to take good care of themselves. And I think what you said, it's true. Many people, I think, come back and then get care at home, and they're probably worse off because they didn't intervene as early as they maybe could have if they would have known what to do.
Yeah.
Yeah. And Summer, we've talked a little bit about like Explore Well in terms of the city guides, and how you described them in terms of being able to provide like that whole person, supporting like the whole person, when people are traveling. But we'd love to hear you talk about Explore Well in terms of like what is the full platform? What does it involve? What does it include? And you touched a little bit about like that end-to-end journey for people when they are traveling, but we'd love to hear you describe what Explore Well is all about and what people can expect when they visit.
Yeah, thanks for asking. So it is broader than just the city guides. It is a digital health platform that has content as city guides. And so that is a blend of our established ExploreWell local community members. So we find people within each community that we build city guides in that are knowledgeable on at least one of the four of our key pillars. So medical, wellness, fitness, or special diets. We feature their bios on our website, and we basically are working with them to be our local friend when you don't have a friend in the area that is giving you their local insight and advice. So between our ExploreWell locals, our own research, and then we have had multiple ExploreWell writers, we have also generated a lot of article content. So, how do we help people by providing them with some tools and some structures that allow them to advocate for themselves and their travel
Mhm.
partners more effectively, such as the translated information from English or their native language to the language that they're traveling in, and then also just some other guides around how do we communicate with providers, some cultural considerations, so some other tools that really just make it more structured and seamless to interact with local resources.
Cool.
That's really cool. And, Summer, one of the things I love the most about ExploreWell is it's a digital platform, but it allows you the ability to really experience a culture and a city in a way like locals would by connecting with people who are there in those cities, who are experts, and who really know how to navigate, whether it's fitness, wellness, medical, or special diets. I love that you've kind of taken the idea of a digital platform, but then you're able to offer people like, in-person experiences as a result of that.
Thank you. It's really, I mean, it was created really out of the needs that I saw with myself and my family. And so for me, it is really exciting because we've been talking a lot about the response to the medical stuff, like if you get ill or injured, but I mean, the really like fun, exciting stuff that's in it too that we focus on is, how do you eat the local cuisine, but still do it in a way that honors your dietary needs or
Mhm.
preferences. And you can have you can have gluten-free food, you can have vegan food, and you can still experience that. It's really exciting what people are doing now with some of the innovative options and in different cities and in different cultures. And then the wellness experiences for me, I'm always so curious. what's really unique about this place that I can't do at home, and maybe what's more budget friendly in this place that is out of my budget in my hometown. And the fitness, so many of the fitness experiences, we do focus on a lot of the outdoor activities and what can you immerse in that's just free. And then from a gyms and studio standpoint, like what are some places that you can go to that offer short term or like day passes? Some of that for me, it really helps package like you talked about, like what is life like here? What are the local gems and how do I immerse in some of that regardless of how long I'm there? So it's a good opportunity for us to highlight some businesses that we think are really aligned with our mission and are really promoting really healthy life choices. And these aren't sponsored listings for us. These are places that we find out that are vetted again by our ExploreWell locals and by our own research. And so it's a pleasure to be able to highlight some really neat local businesses too.
And
Yeah.
how do people become an Explore Well local? Are you finding these people or are they reaching out to you? How do you make those
So
partnerships?
if you have listeners that are feeling like they really identify with one of those categories or with multiple of those categories, I we would love to connect. We love when people are interested in becoming an Explore Well local. A lot of them, fortunately, so when we were living in Krakow, we were a part of a community of it represent our school community was built up of um, students from more than 44 countries.
Wow.
And so that was a really exciting launch point of this is wow, we were able to really connect with people from many places and so many people that are expats, they have also been expats somewhere else, or they have friends that are expats. And so we were able to build a really strong network of ExploreWell locals just from our own community and from primary and secondary connections. And so far, a lot of them have come from that. And then those people, like just through learning about ExploreWell, then we have gotten some other people engaged and interested. And it is such a gift. It's such a generous, wonderful gift for people to offer their unique perspective and insights because it really helps other people. And I think
Mhm.
what I have noticed as a commonality between our Explore Well locals is these are people that are travelers at heart. They love to travel and they're passionate, health conscious people. And so yeah, if more of those people that would like to be involved, we would love it.
That's cool.
That's really cool. Summer, maybe you've thought about this in this world where we feel like we're so dominated by AI generated content. It just feels like it's everywhere. It's all people can really talk about. And you're really going in the opposite direction, right? You're talking to people on the ground, locals who are experiencing their cities and sharing those gems like you talked about. So, what do you think about this from an AI perspective? What does that look like for you? What does it mean for you? And has that decision been intentional about really going to that human first experience and lens?
Yeah, I would say we would be remiss to not utilize AI as a
Mhm.
resource. With ExploreWell, I use different AI platforms multiple times a day. I think that the AI tools that are already out and that are coming out and evolving are incredibly useful. But I do consider some pieces of AI a competitor to Explore Well. I think that there is wonderful opportunity to get some baseline information by using AI. And I think that I would encourage people to do that. But I think really vetting it with the experience of locals and having that vetted research that we do in addition, I when it comes down to your health, I think it is important to have a fuller picture, especially right now. I have done comparisons where I have tried to just use AI to create some things, and sometimes it has pulled in resources that are not even in the same country that
Mm.
I've asked it to. And we
Yeah.
actually just we had some friends over for dinner on Saturday night, and it was just this is not really health related, but we my kids go to a Spanish immersion school, and so our friends there's a trip to Valencia, Spain for fifth graders every year.
Mhm.
And so some of our friends that were here, their child is going this year, and they were looking at some day trips to go to when their child is in Valencia. And some of the friends that were here are from Spain originally. And so,
Mhm.
anyway, so this friend of ours that's going to Valencia for the first time, she used AI to look at what are some great road trips around Valencia. And a few cities popped up, and she booked a stay at one of the cities. And the people that are from Spain were like laughing so hard about the fact that she had chosen to go to this place. And they're like, why would you go there? And she's like, well, it sounded really pretty. AI explained it really great. And he's like, that is not somewhere that I would ever recommend you going. And it's just, it can't take into consideration like full person, full needs. And I think sometimes it's just really, really important, especially when it comes down to our health. Like it means a lot when you get a personal recommendation. I know for
Oh,
me,
yeah.
when I get a personal recommendation for my children on, okay, I now need to see a specialist for this. Who would you go to? I feel so much safer going to someone that I trust and asking
Mhm.
them that works in the community, that is a healthcare provider, and says, I know this person, I know their work, go to them, versus having an AI tool search the internet and tell me there's something really trustworthy about human connection. And
Yeah.
I think we really need to keep that, and I think we need to blend it with AI research. And so for me, that's really the goal of ExploreWell is really to have that comprehensive view on things. And so we do utilize AI, but we check all of it, we vet all of it, and then we back it up against what our interviews with our ExploreWell locals say.
That's cool. Yeah, I'm sure that even using AI to create a list of things might come up with some ideas that a human connection might have forgotten about and being like, oh yeah, actually that is a really good place to go to.
Yeah,
Or
and that can definitely help. And so I think using it as something that really is a hybrid to build a really synthesized comprehensive solution is what we are aiming for.
Mhm.
Yeah.
Yeah, that's fair. I think that the majority of us are using AI these days. And yeah, if you're not, then you might be missing out. And it's fun to kind of play with it and see how it can support what you're doing. And
Yeah, but it's true. There's nothing that exists that is more powerful than the trust of a human
yeah,
connection.
Yeah,
Uh,
even
I
for a restaurant recommendation, if you
yeah,
know somebody's eaten there and they like it, then
right. There's
yeah, I'll
something
go
that
there.
just it does. It rings to a truer kind of like deeper, I think, trustworthiness to have a
Mhm.
connection that, and that's why we build out the bios of our ExploreWell locals and we try to get diverse feedback is when you have a local friend in a place, you're good to go along with them. And a lot of times they'll know what to do in this circumstance. But oftentimes when we're traveling, we don't have that local friend. And so Explorer wants to be that local friend. That's really how we've structured it, is that it's a very informed local friend that has the backup of all of that other data and research behind it.
From the experiences that you've had abroad, having to advocate for your health, has it made you a better advocate back home? And if it has, what are some learnings that you have brought home from your experiences abroad?
I love that question. And I love it because before we moved, I didn't know what the healthcare system was like in Poland and
Hmm.
throughout Europe. I knew that they had more national health systems than we did, but I didn't know what a lot of the resources looked like. And I learned, I mean, this was a time where I technically took a career break when we moved to Krakow, and yet it was some of the most fundamental learnings about my career in my life.
Mm.
And the way that they approach healthcare differently than we do in the US. And it has helped me ask questions to our US providers about why they do things the way they do
Mhm.
and why certain options aren't available. And sometimes I have been able to advocate to get those resources available for me and my kids. And so helped me bring a different cultural perspective and understanding, there's a lot of great things about the US healthcare system, but there's also some really there's a lot of brokenness also.
Yeah.
And and that probably exists everywhere, but
Mhm.
there were some really wonderful things that I learned about the healthcare system when we were in Europe that I wish that we could bring here. And so asking for some of that,
Mhm.
I think is one thing. Another is just, I mean, it brought me an abundance of empathy for people that are here navigating, whether it's our healthcare system or the multitude of other systems that exist in our community infrastructures that are English as a second language.
Yeah.
So, I mean, it's just a layer on top of everything else, and it is really complicated. And
Mhm.
how do we advocate for and be helpers to people that have that as an added complexity in trying to
Mhm.
navigate? It's really, I had a certain level of empathy for it, um, and saw a lot of vulnerability in my healthcare consulting prior to moving, but it was life-changing to experience it myself.
Yeah. I feel like I'm so ignorant to that fact and that not every healthcare provider around the world speaks English. You think
Right.
that if you're in a European country, oh, hopefully there's somebody there who speaks English, but no, that's not the case. And like I said, I was very ignorant to this, and I just recently was speaking with a interpreter, a medical interpreter or a healthcare interpreter, who works across hospitals, in Ontario or in and around the GTA. And it just, yeah, I was shocked at how many people in Toronto obviously can't speak English or it's not their first language, and the barriers that they face with
Yeah.
doctors. It's, yeah.
Right.
Yeah.
And the cultural components of that too,
Oh, yeah.
how, and one thing I really appreciate about the system that I engage with most here is it is pretty patient family centered, and you can have some of those conversations with providers. It's not always, their favorite, or it's not maybe always welcome to be as high maintenance of a patient as I probably am with my background, with where I ask a lot of questions. I have a lot of awareness around the medical errors that occur frequently because I've had to work them up and I've seen the impacts of those in my professional life. So I come at it with probably a different lens, right? But not everywhere is open to those conversations.
Yeah.
And culturally, that was something too that I learned when we were abroad, is depending on who we were interacting with in what culture, things looked different, and they have
Mhm.
a different tolerance and patience for the type of patient you are. Not to make that too
Yeah.
confusing word choice, but
Yeah. Yeah.
Yeah.
yeah. And so that was really very powerful learnings. Very,
Hmm.
very grateful for them. As stressful as they were. I know it's not the last time that we've interacted with different healthcare systems, and I'm grateful that we've gotten to see so many different things and been able to experience so many different wonderful cultural experiences too, related to our health and well-being. So,
Hmm.
Yeah. Summer, we've loved hearing your story. I think, when we started this conversation, we were talking about how sometimes when you go and you have to experience care in another country or culture, you lose your voice a little bit and you don't always feel as confident as an advocate as you would in your home system. And hearing you talk now about how those experiences have really enhanced your ability to be an advocate now in your home system. It's amazing to see and hear your journey and how you've created ExploreWell, not just out of necessity and the lived experiences that you had with your family abroad, but also out of this true desire and passion to make people's travel experiences like enjoyable, stress-free, and really personal, I think on many levels. And I just feel so excited about, I want to look at your city guides. I want to see where we can go next. I
Mhm.
want to talk to Megan about how we can contribute to a Toronto city guide,
That would
and
be
what we
amazing.
can do to really
Mhm.
help, create experiences for people that feel fun and stress-free and exciting.
Mhm.
So we
I
we
would love
really
that. I always am so energized after I talk to you, Farah.
Yeah.
Thank you.
yeah,
And
we loved hearing this, and just, we'd love to for you to share like where people can find you, where they can learn about ExploreWell.
Yeah, absolutely. I will send you some of that information and also maybe just a link to the article too for how we research and how we have that blend for every category of what are our table stakes as far as making sure that we meet all of that criteria before we list a
Mhm.
resource.
I love that.
Also, just wanted to say before we wrap up, and you can put this here or somewhere else, but something for me that's really important is when we think about people retiring,
Mm.
that's sort of this time in life that we think about people having more time to travel. And at least in the United States, 90% of people that are 65 and older have at least one chronic condition. And that number goes down a bit, but even in my age bracket, it's 35 to 64, 75% of people have a chronic condition. And even children have a 30 to 40% rate of one chronic condition at least. And so, how do we help people travel and bring their whole self with them? And I think some people, they're so scared to go anywhere because they don't feel safe and like they can get the care that they need for their whole person because they're managing some of these, you know, heavy chronic conditions. And so, how do we lighten their load a bit and make it possible for them to go out and have some adventures and feel like they have the tools and the power to take care of themselves? And I think
Mhm.
that's really important to me as a component of the Explore Well.
Yeah, I like that because I think there's probably a lot of people that wait to travel until they're feeling, 100% healthy, but in most cases, you're never really 100%
Right.
healthy, especially
Yeah.
if you have a chronic condition. So being
Right.
able to equip yourself with those resources and tools is so important. And having Explore Well in your back pocket and being prepared for travel in the best way possible really is a form of advocacy, a form of self-advocacy. And I think what you're doing is so great. And I'm really excited to explore your site and see how we can contribute.
Thank you both so much.